We wanted to demonstrate the pop art technique for log rolling that we like to see in interior health, so we're going to show you that now. Whenever we do a log rolling procedure, we want to make sure whoever is at the head of the bed is in charge. So the person at the head of the bed calls 1, 2, 3, we move on 3. That's the only person that gives direction for how we are going to move a patient. Whenever we move a patient, we want to make sure that we check their CMWS to make sure that circulation is all good, and we want to make sure we do that before and after the log roll to make sure that our actions haven't changed anything about the patient's condition. We are now going to roll the patient up to the side. Somebody's going to do an assessment on the back, and then we'll remove the board and put the patient back down. So whenever we do that, we want to make sure that we explain to the patient what we're doing so they know what we're doing. And we do that regardless if the patient is awake or if they are sedated or were obtunded. We want to make sure that they know what we're doing. Now that we have the patient in ICU, we have taken the extrication collar off and replaced it with an aspen collar. We should do that within 24 hours of admission to the facility because pressure ulcers can develop within 20 minutes, and we want to make sure we're protecting our patients. So now that we're in ICU, we're going to get her off of the spine board or transfer board. So I've got my helpers here. We're going to put pillows in between her legs again to make sure that we keep alignment. And now my helpers are going to go the far hip and shoulder and place their arms in cross. Again, I've got the flannel over here on my arm, and my elbows are grounded and pulled towards my body, so we have good stability. And now when we roll up, we want to make sure that we're nice controlled movements. We definitely don't want anything jerky. So on 3, and we've told the patient what we're doing. So on 3, we're going to turn the patient to the left side. So 1, 2, 3.
Once the patient is turned on their side, we want to remove the transfer board. So have 2 people on the side to pull out the transfer board, and we're going to pull it out on 3 with a straight firm motion. 1, 2, 3. Once the board is out, we're going to smooth the blankets down to remove any wrinkles once again, and place the wedge underneath the patient's back between shoulder and bum.
Okay, and now we're ready to roll back down again on 3. So 1, 2, 3. Now that we have the patient secured on a wedge and everything is in alignment, Heather is going to roll up a flannel or fold up a flannel and make sure that we can fill in that small space underneath her head to make sure that her head is supported adequately. Okay. And there we go. And now we need to remove the pillow from between her legs and put it underneath her leg on the right to make sure that it is supported. And now the final thing is to make sure that there are no wrinkles underneath the patient. So I'm going to hold just to be careful. And on 3, we're going to pull out the wrinkles. So everybody's going to pull on their flannel. 1, 2, 3. Okay, and now we have the patient is secured. Now that we have the patient settled and all the wrinkles have been removed from underneath her, we want to make sure that she's in good alignment. So the chin needs to be in line with the umbilicus there, and legs need to be straight, and that looks pretty good. We also want to make sure we check the CWMS of the patient so that we can make sure that there weren't any changes or we didn't cause any changes with our movement, that things are still at her baseline. We do know that some sites don't have access to wedges, so in absence of a wedge, we can use pillows. We just need to make sure that they're the same loft, although most of our pillows are going to be quite flat. So we would just put 2 pillows instead of a wedge. And if we didn't even have any pillows, we can use flannels, just folded flannels. The thing you want to remember with the folded flannels is they are quite hard. So as soon as you have an opportunity to get the patient onto pillows, at least if you don't have a wedge, that would be the best.
Questions have come up on whether or not the spine board, the transaver, or the transfer board can be pulled out from the foot of the patient by lifting the patient and just manually stabilizing the head.
Right now, we say no, that The only way that the transfer board should be removed from the patient is by logroll. And there is some evidence that might suggest later, after more research, that that's okay, but for now we need to follow provincial protocols and health authority standards.
Other question that has come up is how long can the patient stay on the transsaver, spine board, or transfer board?
We want to make sure that we get the patient off within 20 minutes. After 20 minutes, pressure ulcers start developing, and the patient could end up experiencing more pain, and we definitely don't want to do that.
What is the best practice for patients that need to go on transfers within the hospital to diagnostic imaging or OR?
Anytime we're moving a patient on spine motion restriction, they should be accompanied by nursing, a staff physician, or NP. We don't want to leave the patient unaccompanied because they can be prone to nausea, and we definitely want to have somebody there to help support them if they need assistance to protect their airway.
A question comes up on whether or not we need a physician order to discontinue the extrication collar.
Yes, we do need a physician's order to discontinue the extrication collar, and we also need a physician's order to change from an extrication collar to the Aspen collar. If we suspect spine injury on a trauma patient that's come from another facility without a collar, do we have to put a collar on them?
Yes, unless the patient has been formally cleared of C-spine either by a physician at the sending site or by BC Ambulance in the field using the Nexus criteria, the patient needs to have a collar placed.
Thank you for watching our demonstration. If you have any questions about what you've seen here, please reach out to your educator and check the C-Spine Toolkit on InsideNet.